This is Dr. Anderson with North Texas Plastic Surgery, and today we're talking about one of my favorite things, the Mommy Makeover. So I'll get a lot of questions about this because I have a lot of patients that get it, and they'll say, what is a Mommy Makeover? So it's a general term for a combination of procedures done together to kind of hopefully have one recovery so we're not doing a million stages of things. So the most common combination is some sort of breast procedure and some sort of body procedure. So breast is going to either be augmentation with lift, which is probably most common, or breast reduction, or breast lift. Now there's variants of that too that we can go into, but those three things are what I commonly see for the breast portion of Mommy Makeover. Most people that come to see me, they go through pregnancy, they breastfeed, and there's so many breast changes that happen. They get bigger, they get smaller, they droop, who knows? Now, depending on what you feel like happened to you and where you want to end up is what we will talk about at your consult to figure out which variation of that procedure you would like. So, if you say, I was like a solid B and the kids just suck the life out of me, like, thank God they're cute because this is not where I want it to be, we'll talk about giving something with more volume in the form of an implant and then probably lifting as well because of the descent that happened. Now, if that's not you and you're like, I started a double D, now I'm a triple D, it's just too much and I need to be less, we'll talk about breast reduction. And if you're the other person who says, if I'm in my best bra, I love the volume, it's just when I'm out of that bra, they sit in a position that's too low and I'm not liking that, then we'll talk about a breast lift. So just kind of depending on what your situation is there, we're gonna tailor the breast procedure for you. Now, when it comes to body and torso, most common thing, lipo 360 and tummy tuck. With pregnancies, there's going to be some amount of muscle separation that happens. And for the vast majority of women, working out, doing all the core work in the world isn't going to restore you to where you were prior to that child. It's just an unfortunate circumstance that happens. You didn't do anything wrong. It just is. So like I said, probably 95% of my folks, we're going to do liposuction. And the reason for that is extra pockets of fat that are frustrating, that we just diet and exercise seem to be unable to help us get rid of, especially like flank area, or if you had a C-section, area above the C-section below your belly button, just problematic areas that liposuction can help with. Now, if we're super fit and just having some pooch because the muscle separation, we don't necessarily have to do liposuction. It's just the most common thing that people get with the procedure. In addition to those stubborn areas of fat, the liposuction aspect of things really helps me contour so that we get the shapeliness that women are preferring. So I'll jokingly say I have yet to hear a woman say that she wants to be square in her hips or look boxy after the procedure. And I think if you're looking through photos of folks that were doing tummy tucks 10, 15, 20 years ago without any liposuction, yeah, the tummy's flat, but we just have this shape over the hips that's not where women want to be today. So the liposuction aspect of the Mommy Makeover really helps me contour for that. Now, when we talk about lipo 360, there can be some kind of confusion or maybe lack of information out there of what is involved in that. So I will always tell folks, lipo 360 to me means under the breast, down to the pubic bone in the front, armpit to hip on the side, and then your shoulder blade to the top of your butt on your back, all the way around. Now, when I'm doing this liposuction, it's not like, a little bit here, a little bit there. I'm doing liposuction to safely take as much fat as I can to help you get that contour of where you want to be after surgery. I know talking with, loads of patients over the years, sometimes people will say with their Lipo 360 that it's kind of like, oh, we'll do your upper back, or we'll do your lower back, or we'll do this, or we'll do that. No. I think of it as a holistic thing all the way around to maximize the shapeliness, the elegance, the sexiness of the result that we're gonna get. Now, with that, sometimes there are adjunct procedures that we'll do in addition to liposuction to help maximize those results. And usually what that will be is body tight. A lot of people have read about body tight, a lot of people haven't. So if you're one of the people who haven't, let me kind of go into that for a couple minutes so that we can understand what it is, what it's not, and what I expect it to do. So what body tight is it's a radio frequency device that goes under the skin after I do my liposuction to help the way I think about it is shrink wrap your skin back around your body so that we're getting maximum tightening to help ensure that we're getting the best results. So a lot of times if we're talking about this as an adjunct to the Mommy Makeover, we'll do body tight to your back. What I'll see really commonly is just above the level of your lowest rib. A lot of people have a skin crease there, and above that, they feel like there's just like a little pooch there. So what I'm thinking, I'm gonna do this really good liposuction, but then the skin potentially is gonna be a little bit deflated, and like a deflated balloon might sag a little bit. And that's gonna be a bummer. We don't want that. So if we want to get maximum skin retraction after that, body tight can help kind of shrink that up back around what we've left behind to ensure that we're getting maximum results. Now, if you're one of my patients that had stomach surgery, taking medication that's helped you lose a significant amount of weight, and you have a whole lot of loose skin to start, body tight might not be appropriate because it may not shrink the skin enough to give you a result that you're happy with, and then you just spend a bunch of money for a result that you're pissed and you just think I'm trying to steal from you. So we'll talk about that in consult if body tight is the right modality to try and shrink skin, or if there's so much skin that we need to do a different surgical procedure to surgically remove it. Now, I think I've harped on lipo enough. I've said it too many times. We'll talk about the tummy tuck aspect of things. So for me, tummy tuck always involves a few things that help get us to that result. One is I'm always going to do that muscle wall repair. So like I mentioned earlier, after pregnancy, there's some amount of muscle stretching and fascia stretching that's just not totally gonna bounce back, at least if you're coming to see me for this, right? So the muscle repair will help me get that muscle wall integrity back to like it was pre-children. In addition, I will usually actually kind of overcorrect things so that it's probably even better, tighter, snugger, more shapely than before any of the kids happened in the first place. So that's kind of one thing that we think about. Second is the skin removal aspect of things. So there's several variations of tummy tucks, and we will talk about which version is right for you in your consultation. So we start off with, or at least the way that I think about it, is standard tummy tuck. That's the one that we think of as being hip to hip. It's always outside your hip a little bit. That's neither here nor there. We'll talk about where your incision's gonna be and how far it's gonna be, but hip to hip, skin's gonna go away from where your pubic bone is to kind of just above belly button. If you think about like almost like a football shape of skin, gonna go away. Now, in that small caveat, I always try to go above that belly button piercing you had from when you were 16 and your mom told you not to do, because otherwise it gets pulled way down and you have this like little pinches. I always try and take it out if we can. There's probably been 2 people over the years that I haven't been able to, and then we just remove it like 6 months later. Anyways, so that's standard tummy tuck. Now, if there is extra skin extending a little bit farther, we need to start thinking about an extended tummy tuck. Now, this is such an amazing procedure because like 20 years ago when people didn't think to do this, we were getting such boxy hips. And again, like I talked about earlier, women don't want that. I can't speak for an entire gender of folks, like how dare I as a man, but I'm still waiting for the woman to come to me and say, give me those boxy hips. It's it hasn't happened. I don't think it's gonna happen. So the extended tummy tuck can help if you've got skin extending past your hip. That's gonna allow me to get such a better waist for, you know, we're talking about a longer incision. I get it, you don't want a longer incision, but we're talking about this much more to give you such a better result. It's like, it's such a beautiful procedure. I love doing it. It helps so much. Now, if you're maybe in my weight loss category, somebody that's lost 100, 150, maybe even less, but you just have skin laxity that extends even into your back, like we have this back jiggle that people hate. Sometimes we'll talk about doing what's called a circumferential or an all the way around tummy tuck. That's gonna be less common with a mommy makeover, so I'll kind of save that for a different video if I talk about all the massive weight loss stuff, but it's important to kind of have the spectrum of things. Now, some of you are gonna be watching this video thinking, you didn't talk about the tummy tuck I want, and that's the mini tummy tuck. Now, I'm happy to talk about that with you. The thing about the mini tummy tuck that I always tell people is mini tummy tuck, mini results. So if you come in and you don't have any skin laxity, but you're just pooched out from the stretch, then we can talk about a mini tummy tuck. The problem with that for most people is the amount of excess skin that's there versus the amount that's removed with the mini is discordant. Like, it only takes a smidge of skin, but we have more skin that needs to be removed. So again, we can talk about it, but the likelihood that that's gonna be the best option for you is pretty low. Now, if you're the 1-2% of people, absolutely we'll do it and we'll get a great result. I'll have people come in, you know, that had 17 kids and triplets and all this, and they're stretched to high heaven and they say, I want a mini. And I'm like, we won't get a result that you're happy with. And we'll go through that and I'll try to help you understand my perspective so that we can get there. The third thing that happens with the tummy tuck that's also beneficial is, so we got the muscle repair. That's gonna get us from our side view a lot flatter. We talked about the skin removal. That also helps with the side view, but it's in our front view that's gonna make things look flatter as well. The third thing that happens is, if you can imagine, you know, now you only have skin from right below your breast to where your belly button is. That's all the remaining skin is all getting pulled down to where your pubic bone is. So if it's this thick after your liposuction, as we pull, it's gonna get narrower as well. So kind of the third thing that happens is the little pinch of fat that most of us have over our abs is, I'm gonna lipo it, and I'll talk about that here in just a second, but it gets lipoed and pulled, so you're getting multiple things there to help smooth that out. Now, one really important thing to talk about when we're talking about the liposuction of the upper abdomen with a tummy tuck is one of the, if not the most important principle in all of plastic surgery, and that's blood flow. So I'll try not to get too complicated and make your eyes glaze over and just make you tune out of this video, but we're talking about surgery, incisions, there's things that need to heal. And for something to heal, you have to have blood going to it from an artery and then veins going away from it. So if you do too much liposuction, you can disrupt enough of those blood vessels that the skin won't want to heal, and you can actually get some skin death and necrosis. And that's a very dirty word that we don't like to talk about when we're talking about cosmetic, aesthetic, plastic surgery. So to help ensure that, I have to back off my liposuction here just a little bit. But with that, I'm still gonna do those high definition things to the abdomen that make the modern tummy tuck look much more natural than something that we saw 20, 30 years ago. So there's gonna be a little bit of extra liposuction in the midline, a little bit of extra liposuction at the sides, so that way when we heal, you have some of those natural hills and valleys and shadows that will happen, so that you don't just have this flat, amorphous, weird, surgical looking tummy. It looks like as natural of a tummy as possible. Okay, so that was kind of the important thing I had to talk about with the liposuction in the midline. Another wildly important thing when we're talking about tummy tuck aspect of the mommy makeover is the belly button. I did a video on this a while back. that a lot of people have watched, so thank you for watching those. The belly button, not that it's the most important part of the surgery, but it can be the most obvious thing that people see afterward. So I have to take a little bit of extra time and be so meticulous and just instrumental in getting you a belly button that looks like a belly button afterwards. If you talk to 10 plastic surgeons, you're gonna find they do it 10 different ways because there's no textbook way like you have to do it like this. So look at the pictures, make sure that you are comfortable with what you're seeing. Watch my other video so you can see kind of results that I expect to get for you. But that aspect of the tummy tuck is so crucial to get you a result that we're happy with. Okay, so that's kind of the basics of the Mommy Makeover. Generally, breast procedure, whichever version is right for you, tummy tuck with Lipo360, maybe some body tight to the back if that's needed, wanted, whatever. Okay, but Mommy Makeover is an all-encompassing term. It doesn't have to be just those specific things. It really can just be any combination of things that's happening. And let's be honest, you don't even have to be a mom. Maybe you lost weight. Maybe, you're just at a different phase in your life. You didn't have kids. You decided you're not going to have kids. And you're like, I'm not where I want to be. And I want more than one procedure. Now, things that I will also frequently do with the Mommy Makeover, so long as we're staying within our safety zone, because I'm not going to do too much surgery at once and endanger you. The last thing we want is surgery center to hospital, right? But if there's other stuff that we can do safely and we can get clearances and all of that, make sure your lab work's beautiful, things that I will commonly do. Liposuction to the arms. Now, arm skin's very thin. So if we're gonna do only liposuction to the arms and we wanna have maximum skin retraction so that your arm looks, kind of fit and tone afterwards, we're gonna do body tight along with that. Same thing, inner thigh liposuction, very common. Inner thigh liposuction always gets body tight with it as well because that skin is so thin, we need maximum retraction. Thicker areas of skin retract a little bit better on their own. Again, we'll talk about whether or not you need it, but if we're gonna talk about your arms or inner thighs, we kind of have to do the body tight with it. So a little bit less common things that we'll do, liposuction outer thigh. I probably should have mentioned this one first. Most common thing that'll go along with all this, fat transfer to the butt. We're not doing BBLs like people were doing 8-15 years ago, just these giant things. It's much more a very tailored, shapely butt as opposed to just volume, volume, volume. People don't want that anymore. It's more about probably getting a little pop at the top, maybe a little heart shape that's a little bit sexier. Again, we'll determine which one you're looking for. Other adjuncts that we'll see with Mommy Makeover are maybe upper eyelids are looking a little droopy. Upper bleph is a common one, or maybe that little pinch of fat beneath your chin. Submental liposuction with face tight is another common one. Those are kind of the most common half dozen or so things that people will kind of do as an add-on. Now, if you come to me and you say, I want the Mommy Makeover that we talked about, and I want everything else that you talked about, we're gonna talk about staged surgery because we don't wanna have, and we're not gonna have, 10, 12 hours of anesthesia, higher risk for blood loss, higher risk for blood clots, breathing issues after surgery. We're not gonna risk that. So if we wanna do a lot, we just have to do 2 stages, and that's fine, that's no big deal. I do it all the time. We'll allow 3 months for healing in between. We'll talk about it beforehand so we have a plan, and that's what we'll do. Now, something that I think is very important to talk about and probably isn't quite talked about enough is post-op expectations and possible complications. So, we're so inundated these days with all these results of plastic surgery between internet, social media, whatever, and it can be really hard to determine what's kind of real, if this person's talking from like a sponsored standpoint, so they're kind of giving you best case scenario that's not realistic for you. When you come to see me at your consult, I'm going to be very clear with you where we can get to. In addition, we have a 3D imaging program here called Chrysalix that we'll put your pictures into, and I will demonstrate for you where we can likely get with your results. Of course, those images aren't going to be perfect, but they end up being relatively close. And if nothing else, they're a really good talking point for us so that I can explain to you, hey, here's where your scar is going to be. This is how much lift we can expect. This is like roundness of the breast here we can expect if we're doing an implant, if we're doing not an implant, whatever we're doing. So we're going to talk about expectations. And I'm going to really try and make sure that we're on the same page of where we can get so that the likelihood of you being happy after surgery is higher. Now, if we're taking over into complications, I don't like to talk about complications to like scare people, but it's surgery. This is medical procedure. Even though we're talking about aesthetics, things can happen, and you have to understand that that's a possible risk, even though the risks are really low. So when we're talking about breasts, the things that can happen early that require further intervention, the most common, even though it's still very uncommon, would be some sort of collection of blood or fluid in the breast. If that's the case, if it's blood, most likely we're gonna have to go back to the operating room, evacuate any blood that's in there, seal up the blood vessel that's causing the thing, and then put everything back how it was. That really should not affect your long-term result. We should be able to get to the same place so long as we're correcting it right away. If it's a fluid collection of what we call serous fluid that your body just produces, most of the time we can numb you up in clinic, stick a little tiny needle in there, suck out the fluid, and things will be fine. Most people are getting some sort of breast lift with this procedure. If you're getting a breast lift, there's going to be an intersection of incisions beneath the breast called your T-point. In a relatively small percentage of patients, a little stitch can pop there and we can get a little bit of opening. That is annoying, it's scary, it's frustrating, but we're gonna keep it clean and dry, put a little bit of Neosporin on there, and it heals over really nicely in a couple of weeks. That's by far the most common kind of breast thing that I'll see in the early stages that we have to deal with. Some people get a little redness. If that's the case, we'll generally treat you with some antibiotics and make sure that goes away. It'd be unlikely to get like what we call an abscess or a pocket of pus that would have to be drained. That's super unlikely with a breast. Now, more long-term, the things that we'll see, it's hard to say if it's a complication or just kind of what can happen. If one side doesn't settle right, incisions are kind of off, 3 to 6 months after surgery, if there's something that's just not perfect, we'll touch it up, we'll fix it. I will make you whole and get you the best result I possibly can. Tummy stuff is really similar. Possibility of fluid collection or blood collection. Blood's super rare. Tummy, you're a little bit more likely to get that seroma or fluid collection. Again, numb you up in clinic, tiny needle, draw out the fluid, make sure we have good compression, goes away. A little stitch can pop, but that doesn't happen very often. Scar being a little bit wavy, possible, but again, those things can be touched up. There tend to not be too many bad complications with that. Things that we would worry about, like I mentioned earlier, blood clot is something that can happen early, especially after tummy tuck, but we're doing so many things to prevent that before we even go back to the operating room, in the operating room, after the operating room, that the risk is quite low. And we're still going to get an ultrasound after surgery to look for those blood clots. And if they happen, we treat them before they're even symptomatic so we can just decrease the risk of a long-term health consequence of those. So what I'm kind of trying to harp on by mentioning complications, even though we don't really like to talk about it, is we're doing things on the front end to try to prevent them and keep you safe. Another topic, it's not taboo, but like people can be hesitant and dance around it, is BMI or body mass index considerations when we're talking about your mommy makeover. Now, if you go on the internet, you'll see people like different criteria, patient frustrations, because they'll call the office and they'll say, you're over your RBMI, so we got to talk about ways to get that in the range where we need it. it can be a moving target for the exact number of where you can be, where we will kind of have you come in to see consult prior to surgery. So most recently, if you're a younger person, BMI of 32 is going to be acceptable. Now, I understand all your complaints about BMI. It is not the best criteria, although it's probably the best one we got. It can be subjective. If you have more muscle and your muscle's heavier, your number can be kind of artificially elevated. There's so many complaints about it. I get that. I hear it. If you're super close to where we need you to be, I will have you come in. We'll talk. And if it's just like, if it's kind of one of these one-off things where BMI is not the right criteria for you, we can figure out a way to move forward. Now, if your BMI is supposed to be 32 and it's currently 40, we're gonna have a little bit more serious talk about why surgery right now is not in your best interest. So can it be done? Surgery at a BMI 40? Absolutely. But your results are not gonna be nearly as good. You're gonna feel like you spent all this money for something that you're not that happy with. And with those higher BMIs, your complication rate is higher. So what I always tell people when I put on my serious voice in clinic, which I don't love to do, but I have to, is we are talking about surgery that you do not have to have. We're talking about aesthetic, cosmetic, plastic surgery that of course we want to have, but it's not like breast cancer. We don't have to do these things to, save your life, but we're doing these things because we want to feel better. So what we have to do is have you optimized so that we can most likely get through this with least risk of complications and the highest likelihood of you having results that you're super happy with. So we will work with you through different avenues to help get to that safe range so that we can ensure or do our best to ensure that the results are somewhere where you want to be afterwards. So to put it in a nutshell, if you're less than 50, BMI of about 32, but again, if you call me and it's 32.5, I'll see you and we'll figure it out. Maybe you need to lose 2 pounds prior to surgery just to ensure. But that's a conversation that we'll definitely have. And if you're over, we'll have a different conversation and figure out how to get you somewhere that's better and safer for you. So this has been Dr. Anderson with North Texas Plastic Surgery. If you want more info about Mommy Makeover or to schedule a consult, we'll have all the info below to help you do that. And if you liked content like this and want more of it, you can like, comment, and subscribe below.